Next, we have Christopher Proppe from the Kinesiology PhD program.
Pain is a good thing because pain is our body's warning system that helps keeps us safe. But if left unchecked, pain can be debilitating and change how you live your lives. If me just saying the word pain makes you think of a negative experience in the past where you had pain and it changed how you made your choices, you're not alone, because pain affects 126 million adults in the United States. It also costs an estimated $260 billion per year to treat. We have a lot of different ways we can treat pain. But a lot of those treatments require you to spend time and money to come see a clinician like myself, or have negative side effects, and for that, look no further than the opioid crisis in the United States. Well, we can use exercise itself as a way to manage pain. And that's where my research comes in. And typically, in order to get a reduction in pain, it requires high intensity, so near maximal effort exercise, or longer duration, so 30 to 60 minutes of exercise, to get about a 15-minute reduction in pain. As a clinician, that's a lot of work for not a lot of reward. I can't really use that. But my research focuses on using blood flow restriction training. Blood flow restriction training uses cuffs very similar to blood pressure cuffs that we put around the top of your arms or the top of your legs. We inflate those cuffs just enough to slow down blood going into the leg during exercise and don't let any come out. And when we pair that with low intensity or low load exercise, we can get similar or greater decreases in pain sensitivity following exercise. For my dissertation, we had individuals just like you come in and do leg press exercise. We used 30% of their maximal strength, so pretty low load, with the cuffs on, and had them do 4 sets, which takes about 6.5 minutes. Immediately afterwards, we saw a 20 to 30% decrease in pain sensitivity. And the important thing for this is it wasn't just in the working muscle, in this case the quadriceps. We saw that decrease in pain sensitivity across the body in areas unrelated to exercise, like the calf or the bicep. And that decrease in pain sensitivity was still there an hour later. As a clinician, I can use that. If you come into the PT clinic during a rehab session, I can potentially do blood flow restriction training earlier in that exercise session. So that way we can reduce that pain sensitivity so we can progress your exercises, work on that range of motion, try to treat the underlying causes for that pain so that way we can have better patient outcomes and get you back to living your life. The long-term goal of this research is to figure out how we can use this in an overall pain management strategy. Because this is a relatively easy to use, efficient, with a lot of system, with a lot of reward, with not a lot of risk. This type of intervention isn't going to cure your pain. It's not like an opioid that's going to wipe it away, but it can at least turn down the volume on that pain. And when we reduce the noise or the stress of that pain in your life, we can let you go back to living your life and doing the things that you enjoy most that make this life worth living. Thank you.